the people that go in and out of custody in our province, about half of them will have a substance use disorder, and many of those will be an opioid use disorder. So this is a high-risk population.
People who do use opioids regularly can go into withdrawal fairly quickly, depending on their pattern and amount of intake.
Specifically being in custody without any way of maintaining or controlling their opioid withdrawal symptoms, that's when the overall opioid withdrawal symptoms are just going to get worse, and the anxiety associated with it is going to compound and make the patient very agitated.
People feel really, really unwell. Nausea, vomiting, diarrhea, tummy cramps, muscle cramps.
Rapid heart rate, increased blood pressure. It's just a very, very uncomfortable situation overall.
Somebody who's suffering from opioid withdrawal, they can be violent, they can be erratic, there can be some acute self-harm. So it increases the physical risks for both the person in custody, but also for the officers themselves. It's a pretty significant drain on our resources.
When a client is in custody and then is eventually released without the opioid replacement therapy, they'll often be in a state of fairly severe withdrawal, and they would be at the highest risk of relapse and potentially overdosing.
Opioid replacement therapy, ORT, are long-acting opioid medications prescribed by a clinician that are safe to use, and they treat an individual's opioid use disorder. They treat their withdrawal symptoms. They don't get high on it. They don't get sedated on it when they're on the appropriate dose.
This is probably one of the most life-saving medications and medical treatments that can be provided.
So the goal of this protocol was to put together a simple method that would allow individuals to receive their ORT medication when they came into cells so that they would be comfortable.
When a person comes into our custody, we would explain to them the program exists, what it looks like, so that they can speak freely with the medical professional in order to get a prescription.
My role in the ORT in Cells program is basically to receive the prescriptions from the doctor, make sure the dose is safe and appropriate, and then I physically go and deliver the medications to the patients in cells.
It's a much more professional and controlled manner of dealing with people who are in our custody and, as a result, in our care. We are offering this program to anyone that comes into our custody.
If they need to go in front of a judge, if they have a bail hearing, for example, it's very difficult for them to actively participate in a meaningful way.
With the provision of the medication in cells, it does help reduce the anxiety that's associated with it, which means the clients are a lot more capable of making appropriate decisions in terms of talking to a lawyer and talking to the judge and not having the worry of withdrawal symptoms while that's going on.
When they leave, if they are released to community, they leave feeling normal. They don't leave in withdrawal, desperate to find a hit somewhere as fast as they can, anywhere they can.
A smoother transition for the patient or client in custody to long-term custody, mitigate how unwell they are on arrival in long-term custody, and again, decrease the risk of destabilization. We are aware that stigma for people who use substances is widespread.
People who are in cells they deserve the same rights and they deserve the same care that everyone else gets.
We don't see that as a moral failing. We don't see it as a lifestyle choice. It's a medical illness, and that's how we approach it.
I think it's important for us to understand that there isn't an us and them between people who use substances and people who don't. I'm glad that we're doing a good job of starting to understand the stigma that is present and working towards dismantling those barriers.
The ORT program allows us another layer of trying to stabilize them and bring them a little back closer to what healthy it looks like for them.
This is a very straightforward protocol. It doesn't cost much. It is just reframing something and looking at an individual's time in short-term custody as part of the circle of care.
A program such as this, to me, is a basic building block of a safe and effective in custody program from a policing standpoint. It is a low barrier to access. It is almost no cost to the police department, and in fact has improved our interaction with people who are suffering from opioid withdrawal massively. I would encourage any organization that has people in their custody for any length of time to explore connecting with a program like the ORT.